My name is Lacy Knight. I'm a physician and Piedmont's Chief Health Informatics Officer. I took probably the most direct route to become a physician. I ended up applying to a 6-year medical program. So my journey started, at 18 years old, and I finished with a medical degree and a bachelor's degree in biology when I was 24. I decided to match in emergency medicine. I liked a little bit of everything, but I was really focused on a specialty where I felt like I could see that there was a difference that I was making. I feel like the same care that I was providing to patients is still the type of attention and care that individuals need in the workplace, that our clinicians need to consider what they're experiencing and how to make improvements. Good medical care happens through a series of fortunate events, and I started to wonder what could I do to reduce the variability, or at least raise the floor of what that experience looked like, the care experience, the patient's experience, the clinician's experience. Piedmont is really looking at a lot of ways that we can use technology to make the care experience better for the caregivers, for patients, as well as streamline any operational inefficiencies that often come with being a large, complex organization. One of the challenges that's come up with the electronic health records is related to that in-person interaction that the providers have with their patients. The doctor would be there looking at you and then turning to type, and then looking back at you and turning to type, which disrupts the interaction. What ambient listening does, it allows the doctor to use a device, typically it's a smartphone, and the artificial intelligence or AI listens to the conversation. So the doctor's really just having a conversation with you, asking questions, and then within seconds of finishing those questions, there's a note that's drafted. The patients universally felt that it felt more conversational, the interaction between their physician. It felt like the physician had more time to deal with them. I can't think of a better way to show the nursing community how important they are to Piedmont than the investment that is required to take some of the work away from the bedside nurses. So virtual nursing is a program where we put cameras in the rooms, and we have a team of nurses that sit in our support center that connect with those patients in the room, and they take the admission history, they review the medications, and they go over the discharge instructions. It only took one day for the bedside nurses to realize how much work could be lifted off of their shoulders by the support of a virtual nurse. We're also using AI technology to create opportunities to streamline some of our OR scheduling process. Physicians who have time that they're not going to be able to use are more interested in releasing time faster than they ever did before, which means that it creates opportunity to schedule patients in that otherwise may have needed to wait much longer before they could have a procedure done that's important. I think a lot of things that we spend a lot of time doing today that are not difficult to do, but are time and resource intensive, I think a lot of that's going to go away. With deliberate intention and a level of discipline, we can find ways that we can use technology to make transformational difference in the health system.